beyond the academic aspect that these are preliminary results and that they should be published in an academic publication, the other reason why we are stressing the fact that this result should not be disseminated is because it is an ongoing work and there are still plenty of things to be completed before we show you the final figures for them to be used to enhance public policies, which is the final objective of any research study. It is not that because we want to publish in the Lancet. However, this is a very important objective from an academic point of view in order to put Peru in a showcase, as was mentioned before this morning. However, it is because we want to provide results that are reliable and that can serve to political decision makers to carry out their decisions. Basically, this is the scheme of the presentation. We're carrying out an independent research promoted and fostered by Countdown. It is an independent initiative which is carried out by a IAP multi-country initiative, bringing in different initiatives with respect to childhood survival to follow up on how countries were moving ahead with respect to child health enhancement objectives. It was then extended to maternal, reproductive, and newborn health too. The basic objectives are to determine temporary trend from the 19th up to 2012 or 2013 in the country with respect to different contextual factors on a broader macro level, such as social and economic determinants of health, programs carried out outside the health environment, temporary trend of coverage for reproductive, maternal, and newborn health, and the trend of impact indicators for reproductive mother and newborn health, and determine the associations that can account for the causes. This is the result, the preliminary result of temporary trends. We will not mention associations because this is something that is to be completed. This is a conceptual framework for the Peru case study, which includes the different dimensions as were mentioned in the objectives of the research. Basically, what we are carrying out is we're visually exploring temporary trends of the variables which are in this dimension that I were mentioning before, and then we are assessing the associations through different dimensions, through time and space regressions. We're carrying out a detailed analysis of newborn mortality, and we are including equity analysis in the different associations that are being assessed. Obviously, we rely or we trust on the inputs, which are secondary data from different sources, and the analysis units that we are using is the combination year department. We would like to carry out an in-depth analysis using year district information or year village. However, this is something which will come later because we would need to enhance our information systems. In addition, we have included among the objectives an in-depth analysis of policies and programs, something similar to what is being done with the success factors research. Also, a financial flow, and finally, a prediction analysis. Therefore, we are including some intervention covering how many lives would we expect to save in terms of maternal, new birth, or child deaths, using a program that you may well know about, which is called LIST. Now, the preliminary results, part of what I'm going to show you, probably you as individuals or as institutions have already carried out this kind of analysis for one reason. The source is the National Statistic Institute. We will resort to other sources. However, in this presentation, I will basically use the results provided by surveys carried out by the National Statistics Institute. In terms of trends of contextual factors, such as the GDP, you may see that the graph speaks for itself. The progress in Peru is impressive throughout the past decades regarding economic growth. This is some work that needs to be refined. We have used a proxy of the GDP, which is the added gross income at a department level. You can see that there are some departments which have a clear growing trend, while there are others that do not show this trend. In terms of poverty reduction, you know that this can be measured through different methods, but we have used this slide showing the poverty reduction defined as unsatisfied basic needs from 2011 to 2012. There is an evident progress. We will not show the variations at department level because we're still working on them. This shows the progression of literacy rate in women, which is one of the key factors, among others, to achieve improvements in health. The access to tap water, presented as a linear trend graph showing substantial improvement throughout the time, and a visual fast inspection which is only for visual purposes. It could show some inflections that could be assessed in terms of consistency of data. It shows that there are some departments that started really low and that have made important or significant progress, on others where the trend is not the most optimistic one. I want to be very clear on this. We are not assuming any alleged causes with this presentation. We are just presenting a snapshot of a temporary trends. The second part of the work, which is in progress, will carry out a more strict analysis of causal analysis. But this can be helpful for the panel members to carry out an analysis of the trends and the reasons for them. In terms of coverage indicators, we can clearly see that with respect to reproductive health, the percentage of mother contraceptive methods has grown throughout time, and there are some departments which show a positive trend, but others show the opposite. We will not stop to look at each one of them separately for the time being. In terms of mother health, pregnant mothers that have received at least 4 prenatal controls, there has been an increase in the figures nationwide. Every department shows an enhancement. Here, Callao should be integrated in Lima in our analysis process. However, all of them have shown an increase, and we do not see any outliers that have work better than others, or the contrary. With respect to institutional deliveries, there is a clear progress throughout time, and with respect to the departments, some of them, such as Apurímac and Huancavelica, show a growing trend, having started at very low levels. There are others that do not show the same progress. With respect to postnatal care, newborn postnatal care, the percentage of care is really recent, and it is not surprising that this information started after the end of the 90s, around the year 2005, but then it shows a growing trend. This is the department snapshot showing Cajamarca and Huancavelica with a growing trend, important or significant growing trend, and departments such as Loreto, Puno, just to present some examples that don't have a clear growing trend, or Ucayali, which shows a decline. Early breastfeeding is an important indicator to reduce early child death. There's a growing trend, however, there are differences at department level. It shows Ayacucho, Huancavelica, and Huánuco with evident enhancement throughout time. However, there are others that show a decline. With respect to vaccination, child health intervention destined to improve child mortality rate. Throughout the time, you see that this is not a growing trend in terms of BCG, for example. We should discuss the reasons why. And these are the charts at the department level, showing some departments, such as Amazonas, with something going wrong. We should look at the tools of endless, and this is what we're carrying out in the countdown. We are not accepting a priori that the information that we receive is consistent. We are carrying out some work to determine the accuracy of the data to provide information which should not lead to wrong decision. In the case of Lambayeque, it shows a decline in the past years, as well as Loreto, which has many ups and downs. In terms of polio, there is a growing trend, with departments such as Cajamarca and Huancavelica which have improved throughout time, but others such as Madre de Dios and Ucayali which present a different situation. With respect to chickenpox diseases, the national trend does not show a clear growing trend, and at department level we do not see a defined pattern. With respect to the DPT vaccination coverage, there is no growing trend nationwide, and this gives us some room for thought. At department level, trends are not clear. With respect to pneumonia, for example, there has been an increase or an enhancement nationwide, but at department level, we do not find a clear trend showing some that have done well and others that have not. With respect to percentage of children that receive oral rehydration, in the case of diarrhea, at the department level, we do not find departments that have spectacular increases and others that don't. With respect to impact indicators, I must say that the figures I will show are only nationwide, they are not departmental. We would like to use registered mortality rates. I think this is a challenge that our country needs to face. It is not possible to use endless figures in our analysis for the reasons that you are all aware of. The national endless figures with respect to mortality refer to the 5 years prior to the survey, and department results show results 10 years before the survey, so we meet the actual recorded death or mortality, and there are important hardships in terms of registry. But I think that we are moving the right way ahead, and we need this information, even if it's not perfect, to have a more honest and transparent view of how the former information is having a repercussion on mother, newborn, and child health. With respect to fertility rate, it has fallen doubtlessly. We still need to carry out an analysis to see what has happened at department level. These are some impact indicators which Countdown has developed for under 5 mortality rate and maternal mortality ratio, which has made the world community turn to Peru to learn from our experience. And this is a figure showing the new birth mortality rate. It's impressive, at least up to 2012, with a clear trend towards a plateau. The source is UN. It's not the mortality rate registered in the Ministry of Health, but we do need those figures. This is for under 5, showing a decline, but this is also information from the UN sources. This is chronic malnutrition under 5. It is also stunning since 2002 to 2012, and at department level, these are the graphs. We can see almost homogeneous trends in the different departments. Some equity analysis, we will look at them in detail in the future, but I would like to share with you some charts. These 3 charts are the result of the equity teamwork at Countdown that wants to show in a simple manner the inequalities in health intervention in reproductive health to child health. FPS is family planning, 1 prenatal control, 4 controls. Then we have SBA, qualified staff delivery. Breast, we have early breastfeeding in the first 2 hours, DPT, measles, BCG, vitamin A, oral rehydratation, plus continuous feeding in cases of diarrhea, and pneumonia care. If you look at the coverage of the different intervention per quintile, the poorest quintile is the left one, and the richest quintile is the one to the right. So the greatest distance between the poorest and richest quintile, we find greater inequality. Throughout time, this distance between the poorest and the richest has reduced. However, the coverage has been deviated toward the right. I mean, it has increased, which speaks for the effort carried out in the country. However, in the country, there is a significant distance between the poorest and the richest, I know that when we start carrying out this analysis at department level, we'll have different results. Just to show you some raw figures to contrast how much progress has been made in the different reproductive, maternal, newborn, and child health among the richest, the poorest, the rural, and the urban areas, you can see that except for the use of modern contraceptive rate and exclusive breastfeeding up to the age of 6, the other indications show significant progress in the poorest sectors between 2000 and 2012. However, we need to take into account that although each one of the interventions separately show significant distance between the poorest and the richest sectors, I think that we should stress that in general terms, the ones that are not circled have shown a significant increase in the poorest levels. Well, C-section rate have increased in the richest sector. However, it has multiplied threefold in the poorest sector, although we have not reached epidemic figures. This shows the contrast between the rural and the urban areas. The modern contraceptive rate has increased in the urban and rural areas. C-sections have shown an increase in both groups. What is more alarming is that at the rural areas this has increased, although we have not yet reached the figures shown for urban sectors. And in terms of education, secondary education or non-education, modern contraceptive use rate show less dramatic differences. C-section rates show an increase in the sector with the secondary education, but it has multiplied threefold in the non-education sector. And the other kind of intervention show significant variation in the levels with no education. With respect to the challenges that we are facing, the main one that we find is the availability and the quality of information at department level, specifically during the 90s, which supposes that we would need to make significant effort in order to improve our information systems. If we don't have figures to assess, then we have nothing. And the other aspect is quality of information, and the other challenge is to have access to this information. I think that great efforts are being made in the past years, because now we have information nationwide department level, which is accessible for anyone wanting to use this information. However, we need to rescue information of the past decades. Even if they are not perfect, we are willing to contribute with the necessary technical support to make the necessary corrections per sub-registries. However, we believe that our study will be more politically relevant if we manage to receive this information, for example, of register, mother mortality, newborn, under 5, etc., from the 19th up to date at a department level. Finally, this is the research team that is behind this effort, financed by Countdown. As I mentioned before, we have many researchers, many partners, and I would like to thank you for the opportunity that has been provided. I need to show you the preliminary results of this research, and our pledge is that we will complete this result and we will hold another meeting to show you the final results and suggest some actions towards the future. I hope that the panel finds this information useful for their comments. Thank you very much.